now move into the focus for tonight, which is families. And what does happen in families of children with ADHD? According to research, if you compare families of children with ADHD versus families of children who don't have ADHD, these are some of the things you see at higher rates. Not every family has these things, but there's an increased risk for these things to occur. Parent-child relations are strained. Parenting's tiring and challenging anyway. It's especially so when you have a child who maybe is forgetting more than the next kid, or losing more, or not finishing things as much, and running around a bit more, and so forth. It is very common in families of kids with ADHD to have elevated parenting stress levels. And we also see higher rates of some personal problems for parents, whether it be parental depression or in some cases even marital discord. At one point in time, the field thought that the child's ADHD was driving parental depression and marital discord. Certainly it's a possibility, but the picture's a little bit more complicated than that. We now know that adults obviously bring their own issues into their own families, and maybe the adult has ADHD and some of their difficulties have to do with adult ADHD, not the child's ADHD. But in any event, we do know that these are things that can happen in these families, and to the extent they do occur, it informs how you go about treatment. Because it may be the case, for instance, if you've got a mom or dad who's clinically depressed and their child with ADHD needs parent training, that mom or dad's not going to be able to do parent training as long as they're that depressed. So you might have to include treatment for that parent in order to allow them to get to a point where they can provide treatment for their child. Just very quickly, you can't read these graphs, but I'll point them out to you. We did a study a long time ago in which we looked at parenting stress levels in families of kids where there was one child with ADHD and one child without, and compared them to families where neither one of the two children in the family had ADHD. So these are parenting stress levels in the non-ADHD siblings. This is the sibling in the ADHD family who does not have ADHD, and that's the parenting stress level here, very similar to the kids who don't have ADHD in the others. But here you see, this is the child with ADHD in the family and the parenting stress associated with that. Now, the reason I mention that is because someone might say to you, well, gee, you know, you can't, you're having high levels of parenting stress. It's probably not your kid's fault. It's your fault. You're not using good techniques, and so on and so forth. If that's true, then parenting stress should be high for every child in the family, if you're parenting so often. But the fact that we see in the left two columns that parenting stress is relatively normal for one child in the family and relatively elevated for another child in the family does speak to that issue. Now, another thing that we did, we asked the question, what are the things that might contribute to a mom or dad's high levels of parenting stress? And I'm only going to show you the moms. And very quickly, when a child with ADHD also has oppositional defiant tendencies, that accounts for a good chunk of a parent's parenting stress. We also know that when a mom is experiencing depression, that also factors into the parenting stress that she's feeling. Those two factors, childhood oppositional defiant features and parental depression, are also true for dads. So if I put the dad graph up here, those two things would be the same. However, what's different is moms also experience more stress when they don't feel that their husbands or partners are in alliance with them on parenting issues. They feel like they're going it alone, in other words. And for dads, one of the factors that popped up as a contributing factor was the child's ADHD. The more severe the child's ADHD, the more stress that dad had. And the other thing that dads reported is that those who feel less competent in their parenting, they have less parenting skill, if you will, they're experiencing more parenting stress. So while moms and dads might have some things in common as to why they experience parenting stress, they also have some unique features, and knowing that informs treatment, okay? Which is why we love to get dads more into the parent training program, because they might need it more than the moms do. Okay. Yeah. And just very quickly, these are just comparisons of mothers of kids with ADHD against mothers of kids who don't on measures of depression with the blue or purple, whatever color. The one on the left, that's the moms with families of kids with ADHD with higher depression scores. The same kind of pattern would be true if I showed dad scores. So another really interesting question having to do with moms in particular, what's this deal with parenting stress and depression? We did another interesting study whereby one of the things we looked at was, what are the different combinations here? So we found that about 25% of the moms in the sample were very low on parenting stress and very low on depression, which was great. But a very high percentage of them had high levels of parenting stress and low depression. That would be the most common thing that seems to happen. We had virtually nobody who was low on parenting stress and high on depression. And thankfully, well, actually not thankfully, we had a small percentage of parents who were high on parenting stress and high on depression. So it seems to be the case that if you are going to get depressed as a mom or dad, that depression is going to be accompanied by pretty high levels of parenting stress as well. But the good news is, like I said, up to almost 30% of the moms were somehow managing quite well and not feeling high levels of stress or depression. This has treatment implications. Okay. Siblings. Studies of siblings have been few and far between, but what we do find in studies of siblings of kids with ADHD is that their relationships will be different with their brother or sister who has ADHD than another sibling pair. They're more conflictual relationships, less enjoyable. And one interesting thing is that if a child with ADHD is older than a sibling, sometimes in those families, the younger sibling takes on a role more like an older sibling. So we see that that's what we mean by more equal status. Somehow the child who doesn't have ADHD takes on a slightly older sibling role, if you will. Okay. Another important thing to keep in mind is that I've been describing results that come from Caucasian families, studies of Caucasian families, but we do know that people from different ethnic and racial backgrounds have different cultural values about family roles and raising children and so on and so forth. So another of my students did a study looking at, do these same findings repeat themselves in African American families? So we did find that, as is true in Caucasian households, families who have a child with ADHD have some of these same things, including higher levels of parenting stress. What was interesting, and my student explained this on the basis of cultural theory, we did not find that parenting self-esteem was lower in African American parents of kids with ADHD versus African American parents of kids who do not have ADHD. And marital satisfaction wasn't any different, and overall family functioning wasn't any different. There are different views about parenting. Extended family plays a bigger role in some African American families in terms of parenting issues, and it was a very interesting finding. But the main point I want to make is that we do need to keep in mind that culture can affect some of these outcomes, not just the things that I mentioned about Caucasian families. So, bottom line message, ADHD lands on a child in the family, and it's a mistake to think that only that child's affected. As this figure depicts, you start getting this rippling out effect. The child's behavior is affected. It affects parent-child relations. Parent-child relations can begin to affect marital functioning, and you get this even broader effect on siblings. So this is the biggest reason why I think it's a mistake only to evaluate the child. You've got to at least find out what else is going on in that family in order to know whether other members of the family need therapeutic assistance, if not for themselves, in order for them to be in a better position to help the child with ADHD. So that's the background, and we've come back to square one, where we'll now talk about some strategies for explaining this to different people.